I'm from McKesson Specialty Health. I'm a business intelligence architect, and we use Excelsius quite a bit. We're going to use Excelsius quite a bit more in the near future. In fact, that will be our primary method of delivering our reporting. We'll have very little web reporting, that's my hope. And when you see some of this, you'll kind of see why. Hopefully we'll have enough time. I know I've only got a half an hour to talk about some of the other ideas we have. I'd like to get other people's ideas. And anytime, if you want to call me anytime, give me a call. I'm going to go real quickly through McKesson Corporation. We are a large player in the healthcare arena. We can basically be broken, our services can basically be broken down into two areas. One is distribution services, where we distribute to hospitals, patients, doctors' offices, anything from Band-Aids to drugs that have a shelf life of less than a day, right? So you really need to get the drugs to the patient, ensure continuity of care and all. And to our technology services, where we offer a variety of technology services, including lock boxes for various drugs that need to be controlled, highly addictive drugs, cancer drugs, actual devices that will mix up the chemotherapy because everybody's different, right? So you can't just go grab a chemotherapy IV off the shelf. A lot of this has to be made and made pretty quickly, and it's very dangerous to make this, right? You don't want to be the pharmacist that's trying to mix this up and accidentally inject yourself, right? We also offer services for actually Scottsdale, Osborne, and Shea use our software to order pharmaceuticals, to track the patient through the hospital, make sure the nursing stations have what they need, a variety of different things. And then I work for a section of McKesson called McKesson Specialty Health, and we're a little bit different, still dealing with patients, but we offer a variety of programs that make sure that the patients actually get the care that they need, the drugs that they need, and are using them safely and are persistent and compliant using the drugs. So for example, we have reimbursement services which help patients navigate the wonderful world of third-party payers, right? Appeals and prior authorizations and all this other neat fun stuff, to patient assistance programs, which, I don't know if you see the commercials on TV all the time. If you can't afford your drug, company X may be able to help. These are patient assistance programs. We design and implement those, as well as drug safety programs, which is what we're going to talk about today. And drug safety programs take a variety of forms, right? They can be the little insert that you get with your prescription that you probably immediately throw away, right? That's part of the drug safety program, right? FDA mandates that those are included, but most people just throw them away. To outbound calls for nurses to making sure that you're taking your drugs. Do you have any adverse events? To full-blown FDA mandated programs, such as REMS programs, which is risk evaluation and mitigation strategies, that make sure that physicians are compliant with various laws and things. And what this tries to do is prevent problems such as, does everybody know what a teratogen is? No, nobody knows what a teratogen is. Why would you? There's two very famous teratogens, and one is thalidomide. Has anybody heard of the thalidomide disaster back in the 60s and 70s? Yeah. Caused severe birth defects, right? This was a great drug. You couldn't overdose on it. It caused you to relax. It basically eliminated nausea, so it was the perfect thing for pregnant women, right? Perfect thing. Severe birth defects. Children were born without arms, hands attached to arms, feet attached, without faces, severe birth defects. Another famous teratogen is Accutane. Everybody's heard of Accutane, right, for the treatment of severe acne. So what a risk evaluation and mitigation strategy program does is, okay, Mr. Distributor, who's got the drugs, right, you have to be enrolled in the program and know all about this fun stuff before you can even ship it to a pharmaceutical, before you can even ship it to a pharmacist. And Mr. Pharmacist, You have to be enrolled, or the pharmacy has to be enrolled in the program and understand and take all this continuing education and all before you can even dispense it. And you can't dispense it unless the prescriber is also enrolled, right? Has had conversations with the patient, and this is the kind of the exciting part, you can't take it unless you can prove that you've had a negative pregnancy test within the last 30 days and can prove that you're on another form of birth control, right? So kind of bringing it all in, bringing the safety in, but at the same time trying not to be a barrier of access. Because the last thing that you want to do is say, I'm sorry, Mr. Chemotherapy patient, who's in a terrible amount of pain, you can't have this drug because your prescriber hasn't had your talk with you, right, and all this. Or, you know, your doctor, you're in a rural area, the closest doctor that you've got is 100 miles away, and you can't have this drug, right? So there are some varying things that you have to look into. And then monitor what is going on with noncompliance, what is going on with adverse events and things like that. So there's several reporting challenges with these programs. Number one is that they're very longitudinal. They're longitudinal programs, right? These things go on for years and years and years, right? Enrollments, people drop out, opt out of the programs. They're incomplete for several reasons. I mean, just tons of different things associated with longitudinal. You also have, because they're so expensive to implement, we're starting to see that many pharmaceutical companies will come together for a class drug, okay? I can't get my wife and 2 children to agree on a restaurant to go to, right? Try getting 10 pharmaceutical companies to come together and say what this program is going to look like and what they want to see with reporting and whatnot, right? So add to that the fact that we've got to report to the FDA, and that McKesson has its own internal needs. You've got a quagmire of reporting needs and all, right? So somebody brilliantly said, let's dump all the data into a detailed report and send it out to everybody. And I see everybody shudder with fear, right? Yeah, because you know what's going to happen, right? Somebody's going to forget to include this month. Somebody's going to not include this inactive reason or the opt-outs or whatnot. And you're going to get on a meeting and you're going to spend an hour just coming up, just finding that there's not an issue that was a perceived issue, right? So really wanted to bring things together. Also, all these programs are highly customized for a variety of reasons, right? And we don't want to be redesigning the wheel every single time a new program comes with a couple different rules and all, okay? So what we came up with, and I'm going through this pretty fast because I want to get to the fun stuff. Launch, enrollment, difficulties of planning, longitude, nature, I talked about that. Our inspired solutions. So a couple years ago, well, actually last year, I guess it was Inspired BI. I guess the year before it was Inspired BI too, right?
It's always inspiring.
It's always inspiring. And I like that it's imaginative, it's creative and imaginative. We really needed to move away from these large data sets that we were just dumping out there for the world to see. And I played the card of, well, you know, patient confidentiality and all this other stuff. Do you really want all this data out there? You know, puts you at risk as well for various audits and all. So we came up with an interactive summary dashboard that would get everybody pretty close to where they needed to be, and then we could do direct data snippets or whatever to fill in the voids of the other, while still maintaining those data sets. And you'll see in the dashboard that you can actually go out and access those data sets. But yeah, so we solved our problem through some pretty fancy back-end data processing, which I'll talk a little bit about. This project has actually led us to the point where we're now, where we're totally redesigning our data warehouse. So we're going to do some pretty cool stuff. And maybe eventually we'll be able to talk about that. We make heavy use of InfoBurst and their caching capabilities, as well as their two-dimensional pivot tables. This dashboard could not be done without caching. I mean, we are dealing with a ton of data. We have great performance. It's it's been very well received. And we've actually taken this model and have applied, I don't know, 7 proof of concepts very easily. I've brought up 7 different dashboards, and I'll tell you how I did that within days. I mean, literally 7 different dashboards, totally different data sets within a couple of days. So we really spent a lot of time kind of thinking about the structure. There's a lot of things that we're looking at changing now, which I'll talk about as well. And we did some neat things with Excelsius, some creative solutions, which I'll show you. So our dashboards are available via an InfoView portal. We're currently in the 3.1 environment. Hopefully this year we'll move to 4.1. And it is a connected dashboard because of the amount of data. So, first innovative feature before I jump into it is we have a lot of metrics, right? We have a lot of stakeholders, as I mentioned, patients, prescribers, inpatient pharmacies, outpatient pharmacies, distributors, whatnot. We have various periods that we want to look at. And it's easy to click on a row and have something happen, right? But what if you want to click on a certain cell and have something happen? So program to date with corporate substore or outpatient pharmacy. Okay? We solve this problem by literally taking a scorecard control, adding it, and through various clicking and whatnot, we can now drill to that individual cell, right? Very simple to do. What's cool about this is because it's all based on a query, right? I can pass anything to this, right? And because of Excelsius's built-in functionality of ignoring cells, empty cells below and across, if I add 7 or 8 hospitals, prisons, military, whatever, automatically flows through. I don't have to do anything, right? Obviously, these are hard-coded, and I'm limited to the 6 that I have here, but I can pass anything through this too, and I have, right? So I've wrote a quick query, totally changed this, and now these are all client names. So corporate can see, hey, how many enrollments do we have across the board? Very simple. That was a 5-minute change. So when you're designing your dashboards and whatnot, you can think about these things, and very simple. You change the query that sources the cache, you're done. Reassociated. Make sense? Cool. My favorite part is this. 2 years ago, did anybody go to IDIS 2 years ago? Saw the HTML5 display with the cars, and there's nothing else to say, and it's on your website, right?
Yeah.
Nothing else to say, but it is sexy. Okay? It is sexy. They click on stuff, and stuff moves around, little boxes move around. Okay? McKesson doesn't want to really spend a lot of money, right, for tools. Use the tools you got. Come up with creative ways, which is kind of fun. So I wondered if I could do something similar. And this was our attempt at a proof of concept, which we've taken to 2 or 3 new levels. But this is basically each of those little boxes, and go online and look at it, because it's fun. It's fun to play with. You show it to somebody, everybody goes, ooh. But with Excelsius and the dynamic visibility and all, again, it's just passing numbers, right? It's all numbers. It's a query. So if somebody clicks on something, you can rearrange these things through dynamic visibility. We started taking it one step further and combining the space of 3 of these and putting a graph in it. So if you want to see numbers or a graph or text or something else, all through dynamic visibility. And you can move things around. You're not really moving things around, you're just turning things off and looking at different, on and off and looking at different layers. So it's not quite as sexy with the movements and all. But yeah, it's very exciting. It's very exciting. Okay? So hopefully, in the near, not so near future, we'll be able to show something like that. Okay? Dynamic architecture. We had a problem where, again, we have a lot of data, right? And you want to show a graph. And we figured that 60 points was about the best, 60 data points is about the best visual for some of our graphics that we're doing. So how do you make sure that you're showing as much of the data as you can so you can get a really nice curve right? Without truncating and all. So you got year to date that you want to show, right? You just don't want to show months, right? You got 60 points, right? You can show weeks, cool, but you go program to date, and that's 2 or 3 years. You got to do some calculations, right? So we get some fancy back-end processes, and then with the XML caches, we're able to, on the fly, figure out, okay, who selected what when, and how many points can I throw out there? Right? Doesn't do it as well as I would like, because if you happen to do every third point and those 2 points that you're missing are the ones that you really wanted to pull out, so I'm still trying to work on that and trying to see things. And I think the solution for that is having another graph that's kind of shown but highlighted out, which shows the actual, curve without any of the labels down below, because Excel has got a problem with the labels, right? I mean, you can put 400 points on, but if you're just showing labels, it becomes irreadable, right? You can't skip every other point and so forth. Okay. So we did that. Now we're here. So this is live, right? It is live. Okay. Wanted to point out that we also did a bunch of other things. So we can export to Excel through the cache. I don't know if everybody uses Excel still, or does that? How many people use the Infoverse tool here for dashboards and all? Just a couple. Yeah. This is great. Your users will love this. They want to put everything in Excel anyway, right? Which kind of defeats the purpose for getting away from the big data sets and all. But we found that we were spending at least 20 hours a week answering data questions. And when we implemented this, 3 days later, it dropped to an hour. Right? And they were good questions that were being asked, right? What about this, and what about this? And questions that brought everybody together, and it was starting to become a collaborative effort of how can we make the logic better, and what can we do to ensure patient care and ensure everything. Export to Excel, we have print functionality, which creates a PDF. We can go and grab Webby reports. So if I click on patient, you'll see that goes to my patient detail. Everything's changing. If I click on prescriber and go month to date, you see that it all moves nicely, and that we can choose incomplete. We go to incomplete reasons. We can change our assessment periods. The FDA requires assessment periods. Some of our programs are 6 months, some of them are a year. This all changes. We can do your standard going to 2 months. Pick your month, so on and so forth. One of my favorite things is the map. We use deciles. Luckily for us, most of our territories for our safety programs are state-based and not territory-based, where you're splitting Northern California or you're combining. Of course, there are tool sets that allow you to do that, but you can easily click on and view charts by the state. Oh, I'm incomplete. Let's go to enrolled. So state of California. Oh, this guy doesn't seem to be.
Not all the data's there.
No, the data's there. I thought California was there. California for corporate stakeholder. I think it's prescribed. Now, we can also view. Oh, and by the way, all of our quartiles and all are being calculated on the fly as well. So, very exciting stuff. And performance is very quick. Everything comes back within a couple seconds. That was one of our big things. In fact, that was probably something, if I could change anything, we made it pretty heavy. So we've got the enrollments, our PEDs, which are our patient education discussions, assessments, which are knowledge assessments and how everybody's doing, contact information, fulfillment information, when are we sending out what pamphlets and whatnot. If anything, this gets a little heavy, right? So I'm very happy that everything comes back as fast as it does. What we've decided to do now is really start breaking these up into more modular sections. So there's an enrollment dashboard, right? And the enrollment dashboard will have this, but it'll start off with a page that look like that looks more like this, with the key metrics and all, and graphs if you want to go to graphs versus data, and that will take you then to a re-enrollment, right? And we're starting to get a lot of traction with creating our more analytical dashboards, right? So predicting when folks are going to re-enroll, right? How are our outbound campaigns going to contact physicians to make sure they re-enroll, things like that. I could talk about this stuff forever. Does anybody have any questions or anything? Go ahead.
Do you have alerts in that when you're, let's say, out of spec?
Yes, I should have brought my laptop in. We actually have a data quality, well, we've got multiple. We've got a data quality, which is actually monitoring our data warehouse load processes and all. So if we're seeing that, oh my gosh, suddenly we've got 2,000 enrollments, what's going on? Well, re-enrollment's just kicked off. So, but it's smart. It figures out things, historically and whatnot. So we're not just doing thresholds. I suggest people don't do thresholds. It's very easy to look at things and go, okay, have it dynamically calculate your averages, because Mondays are different than Tuesdays, and we try to predict seasonality a lot, right? When's the allergy season coming? Because oh my gosh, everybody gets right now we're in a big flu epidemic type thing, right? There's also a lot of allergies, right? So allergies are kind of, if you look at, if Google can predict this very nicely, actually. It's kind of funny. Has anybody seen those results? Have allergy season, and then boom, you'll have flu season. Because everybody's Googling allergies, hay fever, what's the particulates, blah, 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 right? Oh my gosh. I don't have allergies, I think I might have the flu. What's going on with the flu, what's the breakouts and stuff. And Google can actually predict a flu breakout in a very localized area faster than the CDC can. It's amazing, okay? They're actually starting to contract with them to do some of this stuff. But yes, we have all that, and that gets into more of to your question, gets more into this, right? And to give some kind of graphical representations of it. Has Renali showed you some of the stuff that we've done with that?
No.
Yeah, so, and you can compare it to other times, and how many records have you blown out, and yes, is this plus or minus what we're thinking, and compared to other cohort populations and so on and so forth. We're really starting to get into that, which is requiring us to totally rethink, like I said before, our data warehouse, because you really have to have something set up a lot differently than your traditional data warehouse to do that.
Your export to Excel, how does it work?
It's through it's an Infoburst cache.
Okay.
And you could probably explain.
Yeah,
it better than I can.
it's another one.
magic to me.
It's another one of the connectors that comes with the Infobust XDC. Okay, so it's called Save as Excel. So you have connectors that allow you to connect to the cache and execute query statements like David is doing here. You have connectors that can save as Excel and take any data that's coming in through the dashboard and save it out to Excel. You have connectors that can do write back, that can actually write back to the database as well. So all these things are built in as part of the solution.
The only thing it will not do is if you've got a graph, it will not export the graph to Excel. It'll export the data, the underlying data, but that. And with the write back feature, we are starting to, we've got a couple of proof of concepts that we're working on now. We've got a lot of proof of concepts. People say I get panic and I get bored of these, throwing these things, but look what we can do. That we're actually starting to monitor who's clicking what and write that back, right? Or somebody's got a question about data, instead of emailing and doing everything, have a little section where, hey, you got a question, click the button, you write it back, you save the data. And then you can start seeing, and other people can view, oh, these questions have been asked already. we're handling it, you can look to see what's going on. It's only limited by your imagination, you can do a ton,
And budget.
And budget, yes. And time, it's all about time. I was talking to somebody today, my son asked, what do you want for Christmas? I said, just time. Just 2 months, I need a sabbatical. Where I can play with stuff. Any other questions?
So you're just using SQL in all these, in the caches? No universe, no nothing?
Right now. Right now. Our universe didn't lend itself nicely to longitudinal analytics, which is why we're in the process of designing and rewriting it. Yes, you do get a lot of benefits from hitting the universe and hitting weather reports and sucking that in. You can do a little bit, but again, with the two-dimensional pivot that's offered, you can do quite a bit with that, with Infoburst as well. Have it really quickly aggregate.
You got a trending piece there as well, right?
Oh, yes, gosh, forgot about the trending. So this is what I was talking about when we automatically figure out how many data points to choose. So we can go prescriber 60 days on 2012 and have it automatically figure out what's my best every other, every fifth, every sixth, every ninth, so we can truly get a trend. And of course, standard functionality. To your point about alerts, you're asking if we do alerts. Yes, we have some alerts that we put in for various rules and all. You know, California's okay, Alabama, Alaska, and Arkansas. We were thinking we'd have a little bit more of the population there, right? Without giving it away, it's several different things. Whether they're in progress, whether they're re-enrolled. Well, now whether they're re-enrolled, this is kind of an older version. Whether they're actually complete. And then we have some other models that we're working on, using some of the Google tools out there to see, how far is it to the nearest doctor? Do we have a barrier to access, right? A straight line, it may be 20 miles, but boy, there's that mountain river in the way, and you've got to go, 100 or so miles, so that we can make special exceptions for certain folks and get special dispensation. Shoot, how much more time do I got?
3 minutes.
Okay, any other questions, or?
How much of your effort was spent building the data warehouse as opposed to delivering the data?
The data warehouse it's really not even a data warehouse, it's just a SQL statement, it's 3 or 4 SQL statements.
But huge tables or something?
Well, I mean, they're not too bad.
Okay.
They're not too bad. I think it was about a week. I mean, we had this up and running within a month.
Huh?
And that was with me being about 30 to 40% on, and then one other person being 100% dedicated to it. So, and then like I said, I mean, we did a re-enrollment. Well, we took this one page, we took this one here. Oh, let me go back, sorry. We took this and changed it for, top six programs across the board, and it took us 2 days. And that was with testing and documentation and all the other fun stuff that you have to do with the FDA-associated program before you can have anybody even look at the data.
Did this evolve much, or did you?
This continues to evolve.
Yeah.
Like I did mention it, I mean, it's going to look totally different in the next iteration than this. We'll use certain components and certain ideas. I'll continue to use this type of a solution and all, but yes, it's evolving, and it's evolving more towards the please go to the website and take a look at that HTML5 thing, because it's really, but it's evolving more to that, right? The real thing is, how do you keep folks interested in it, right? So if you've got these, and it's done pretty well, if you've got all these boxes, you mix them up every once in a while, cause people to look at things a little bit differently. First, it's like going to Google, right? Who loves going to Google and saying, is there going to be a guitar on there today that I can play? Or is there going to be some kind of, whose birthday was it today? And, those types of things in the art. How do you keep it interesting? And we're also moving more towards the use of infographics too, right? So putting together a graphic, right? Choose what you want, whether you want a spinner or whatnot, it spins around and here's your metric of the day type of a thing, just something fun, right? Something to keep folks interested in, right? Or what's hot today? What do we see that's hot coming up, right? Re-enrollments are really taking off sooner than we expected. Why? And doing something. But you can create, a background that you use for Excelsius, and then it's just putting your boxes where you want it to be, right? And what you pass to those boxes is whatever you want to pass to the box. They talk about the right back activity and figuring out who's hitting what, when. Yeah, this is something that I'm really excited about, because if we depending on how it pairs out, but how cool would it be to figure out that, okay, all my little boxes, this is what you like, right? This is your view. Right? I can present you with another view, but boy, if I've got this stored and this is your preferred view, here you go. Or you know what? This is what other people are looking at, right? Just like the Amazon thing. I was talking to somebody was mentioning the Amazon. That's right. Here's what other folks are viewing and stuff. You might want to know about it, right? We've got so many different users of this, because the pharmaceutical companies, it's really interesting, because you've got certain folks that call on the prescribers all the time. You got certain folks that call on managed care all the time. You got certain folks that are dealing with the FDA. You got certain folks that are dealing with the distributors, but it all has to come together, right? So you can have the best managed care deals out there. If you're not getting it to the prescriber, they're not writing the script, and you're not making money. You could be out there getting to the prescriber, but boy, if it's not on the top managed care formularies, patients are going to find something else unless there's no other choice, right? So it really has to come all together.
So when this was deployed, how many existing Webby reports did it effectively replace, and what were the
I
real
think it was close to 28.
28? So you basically replaced 28 reports with this dashboard, and what was the response from the user community?
Well, the user community loved it. I mean, our meetings, like I mentioned, our meetings actually went to be productive instead of going to, and once people got comfortable with it and they saw that everybody was saying the same thing, and our internal users loved it, finance loved it, because they could easily go see and project, okay, we're gonna have this many, everybody was seeing the same thing. Yeah, I mean, it was fabulous, which is why we're really trying to make the strides to go towards more of an Excelsius delivery model instead of there'll always be a place for web, right? But if you get people to interact with the data, it's fun poking around, right? It's even more fun if it's sexy like the HTML5 thing, but it's very impressive. I'm a big data geek, yeah. But yeah, I mean, it's made life infinitely easier. One of the other problems that we found was not everything is as big as this program, right? We've got REMS programs that only have prescriber enrollments. Well, using this, when you just have prescriber enrollments, boy, you got a lot of blank space now on the dashboard and all, which is again why I kind of want to go to that other model with the multiple blocks, so whether you want to call them small multiples or whatnot, because you can get more information in.
Sexy stuff.
Sexy stuff.
So we get to see the latest iteration of IBIS?
Yeah. No, unfortunately not. Unfortunately not. Maybe the following year.
I think we should take a vote on that.
Yeah, it's the big holdup right now is is the database and getting that done and doing the things. That's, like I said, I think I've got close to 23 different proof of concepts out right now between database design and Excelsius. And we do Webby reports too. And you put the Webby report next to this, which one's going to win, right? Yeah, I can give you this. And you can go over here to get this information and over here to get this information. But if you really want the holistic view that you can kind of visualize it all together, this is your best bet.
Any other questions? Okay, thank you very much.